John O'Hurley's sister was diagnosed with epilepsy more than 40 years ago. Back then, options for treatment were more limited.
So managing her seizures was very difficult for her. On and off medications, trying to adjust dosages.
As an advocate for epilepsy awareness, John knows treatments today may reduce or in some cases eliminate seizures. So he urges patients to work closely with their doctors.
I think the most important thing that somebody with epilepsy can do is to realize that to manage your condition, you have to have a team approach. You and your physician have got to be a team.
The most common treatment for epilepsy is medicine. There are more than 20 anti-seizure or anticonvulsant medications. Each one carries the possibility of side effects, so it can take time to find which medicine or combination of medicines is right for you.
Finding the correct medication has been a huge process for me.
By working with her neurologist, Tamra found her way to treatment that controls her seizures without intolerable side effects. So for her, staying on her medication is no problem.
Right now, taking my medication is second nature to me because of how long I've been on it for.
As Tamra says, it's a process. For Lourdes, that process took years. She was diagnosed with epilepsy in 1996. For a long, frustrating time in her life, her seizures were uncontrolled. Often, they would break through even when she was on medication. Lourdes is all too familiar with the fear of knowing a seizure may strike at any moment.
What happens if you're out in public, if you're on public transportation, that you can fall and injure yourself, you're not around your family or someone, so it can be frightening to not have your seizures under control.
As a medical technician herself, Lourdes knows it's essential to work closely with a doctor to find treatment that works effectively for her. That requires good communication. Patients need to find out what to expect from their medication and how it should be taken.
The lack of effective treatment is often because the patient either does not understand the schedule of the medication, is not taking the medication appropriately.
Medication may be ineffective because of other factors, including an incorrect diagnosis, medicine not being matched to the type of seizure, a dosage that is too low, lifestyle factors such as alcohol and drug abuse, or drug interactions. One way to keep track of how your medicine is working is to start a seizure diary.
We know when we ask patients in the office, how are they doing, many times they base it on their most recent experience, which is the last 2 weeks or 4 weeks. When we look back over a year, we may get a better representation of their effectiveness of therapy.
The more closely you stick with your treatment plan, the better your chances of reducing or eliminating your seizures.
If your medications are working, you're a compliant patient, you keep your appointments, you can have a normal life like everybody else.
For Tamra and Fred, and ultimately for Lourdes, medicine was helpful in reducing their seizures. But for others, surgery might be considered.
We offer surgery to patients who have not responded well to medication. And in those instances, how we define that is a bit variable, but we've arrived at a general consensus that if having tried 2 or 3 different medicines singly, and then perhaps a combination of medicines together, seizures are still disabling, then we'll think about next steps, often surgery.
Patients with uncontrolled seizures might be referred to an epilepsy center, such as this one at the Mayo Clinic. Surgery is considered when the area of the brain where a patient's seizures start can be identified.
The goal is to remove the area of seizure onset. Long-term follow-up studies at a number of institutions, including ours, have indicated that the majority of these patients are seizure-free or near seizure-free after surgery.
For teens and adults whose seizures are not well controlled with medication, a procedure called vagus nerve stimulation might be an option. The large vagus nerve connects parts of the brain to body organs such as the heart and the stomach. Stimulating this nerve has been found to reduce epilepsy seizures in some people by 20 to 40%.
Vagus nerve stimulation is a little bit like a pacemaker, but for the vagus nerve. The pacemaker is an electrical device that's put in somewhere around here. The wire leads up to the vagus nerve in the neck, and it sends a little electrical current to that nerve, so it reduces the frequency of seizures if adjusted just right.
A special diet may also be considered, one that is high in fats and low in sugars and starch. It's called ketogenic.
And in that one, you're trying to eat foods that will help generate chemicals called ketones in the blood, and those seem to have a calming effect on the brain so that you have fewer seizures.
A less extreme version is called a low glycemic diet, choosing foods that help lower the amount of sugar in the blood. But patients should not try to experiment with special diets on their own.
I think if a patient is going to be on a diet plan for a seizure disorder, this should be discussed with the neurologist.
The first time Lourdes had a seizure, she was asleep. Her husband, Luis, was terrified.
I heard this weird noise, like coming from her breathing. Then all of a sudden, she just started having a seizure.
I woke up in the bathroom. He was holding me up and telling me, hurry up, just wash your face, brush your teeth, we have to go, we're going to the hospital. And I was completely unaware of what happened. All I kept asking him, well, why are we going to the hospital? What's going on? And there were paramedics in my living room.
The scariest part of this whole thing is when your wife doesn't recognize you. That's scary.
Through the years of being treated for seizures, Lourdes has been able to count on her husband's support. Luis goes to the doctor's appointments with her, so he can describe what happens when she has a seizure. The doctor explained how Luis can help.
He asked me to monitor her. If I could, try to monitor, how long the seizure is, how many did she have, and if she had multiple seizures, the time span between each seizure.
Families can best support someone with epilepsy by learning as much as they can about it. To know as much as you possibly can, because there may come a time when you have to be the one that is there to give the help during a seizure.
And looking at seizures that occur on TV and in movies, we know there's a lot of wrong things we can do. We don't want to restrain the patient. We never want to force anything in their mouth.
Your doctor can give you specific suggestions, but the basic principle is to keep the person safe.
If they're about to fall and you can break their fall, do that. You want to keep them from hitting something. If they are having a lot of muscle movement and flailing and they could hit a piece of furniture, you want to try to move that. You don't want to restrain them. You don't want to constrict them in a lot of ways.
Call 911 if breathing stops, an injury occurs, or if for any reason you feel the situation is out of control. If you know what to do, you can provide effective help for the person having the seizure.
That's what I can say to anybody, be prepared, don't freak out, monitor, time the seizures, be prepared to call 911, have the doctor's number ready, have the medication ready, and that's it.